Good morning, everyone. Happy Thursday. My name is Maribel Ochoa, and I am the Communications Director here at United Ag. Thank you for joining us this morning to talk about an important topic, which is suicide prevention. Before we get started with the presentation, I would like to acknowledge our sponsors, CVS Caremark, HCP National, Sain, Planto Nurseries, and Elite Corporate Medical. With that, today we have our favorite doctor, Dr. Rosemary Ku, who's going to talk to us about suicide prevention. Rosemary?
Great. Thank you so much, Maribel, for that intro. And thank you, everyone, for joining us today to talk about suicide prevention. It's a topic that often goes undiscussed, and that actually makes the issue worse. There are a lot of factors that we have dealt with throughout the year 2020, including the pandemic and a lot of social strife that's been going on. That has increased the risk of suicide in our world. So it's really important that we talk about how we can prevent suicide together. Even before the pandemic, over the last 20 years, our nation has actually seen a 33% increase in suicide rates. That's really staggering. And to think about it, suicide was actually the 10th leading cause of death overall. And within certain age groups, it's actually even more alarming. So for people who are 10 to 34 years old, suicide is actually the second leading cause of death. And for those who are 45 to 54 years old, where you're expecting the leading causes of death to be really more related to chronic illness, for those who are 45 to 54, suicide is actually still the fifth leading cause of death, which puts it ahead of diabetes and even stroke. So even before the pandemic, suicide was a huge underaddressed problem in our nation. So it's really important that we talk about it openly to help reduce stigma so that people can get the care they need, because suicide is highly preventable. And in order to prevent suicide, we need to understand the risk factors and warning signs. We also need to know what resources we can turn to in times of crisis. And that's not just for ourselves if we're experiencing those thoughts of potentially harming ourselves, but it's also so that we know where to go in case we hear of anyone else experiencing those kinds of thoughts as well. And then lastly, I'm going to encourage everyone to seek mental health support early and as often as necessary. Suicidal thoughts typically don't just appear out of the blue one day. It's usually a culmination of a lot of suffering and potentially even years of untreated emotional health and mental health issues. So it's really more important than ever before to seek mental health support early. But as I mentioned before, we're facing a lot of conditions today that increase our risk of suicide. And a lot of that is attributed to the pandemic. Early into the pandemic, around June of last year, there was a pretty large study that was conducted to look at the impact of the pandemic on mental health. And some of these statistics could be shocking. So they found that over 40% of adults in the US report at least one mental health or behavioral health condition. And now this is likely an underestimate because people typically don't disclose these kind of conditions. So at least 40%, if not higher, of adults were actually experiencing a mental health issue. About 1/3 were reporting symptoms of anxiety or depression. So if you had any of these conditions going into the pandemic, they were likely worsening as a result of the pandemic. And then a lot of people who have never had these conditions before started developing as a result of all that stress. And then perhaps most concerning is that 1 out of 10 adults seriously considered suicide. So, if we look around us between our coworkers, friends, and family, we typically know at least 10 people. Out of those 10 people that at least one of them statistically considered suicide. And for certain high-risk folks, this number is even greater. So for younger folks, those ages 18 to 24, a quarter of that population considered suicide. And also there are high-risk factors in the United Ag community that made suicide risk even more concerning. So 1 out of 5 Hispanics considered suicide, 1 out of 5 essential workers, and that's all of us in the United Ag community are essential workers. And really concerning is that 1 out of 3 unpaid caregivers of adults consider suicide. And that's a kind of a big catchphrase there, but unpaid caregivers of adults means that if you have a family member, such as a sibling or a parent that you are taking care of, that they can't take care of themselves entirely independently and you're helping them, you are an unpaid caregiver. If that's not your profession, but you are still taking care of them, then you are an unpaid caregiver of an adult. And that's an enormous amount of stress that has worsened throughout the pandemic because most people have to stay home, and healthcare, there was a reduction in access to healthcare. And so that actually also increased suicidal thoughts as well. So these statistics are really worrying. It shows that we have a lot of work to do and that we need to be aware of the increase in risk and suicide that we have been experiencing. Now, these risk factors I want to go through so that you can look at, your own lives and also those of the people that you care about, and kind of assess whether or not anyone you know is experiencing these risk factors. First of all, any untreated mental health condition, such as schizophrenia, anxiety, depression, or personality disorders, can increase risks of suicide. This also includes anyone who uses substances more than they should or are dependent on substances. That's also including legal substances such as alcohol. Anyone who is socially isolating may also be at risk of suicide because they don't have that social network to help improve their emotional well-being. This also means isolation from healthcare resources. So anyone who is not aware of the resources they have access to or is unwilling to access those resources due to stigma could also be at increased risk of suicide. Any history of trauma or abuse can also increase risk. Now, I would posit to say that we've all experienced some level of trauma over the last year, either seeing people around us getting sick through all the life changes that we've experienced through the pandemic. We're probably all experiencing some level of post-traumatic stress disorder from what we've experienced. So we may all fall into this bucket in some shape or form. Any serious physical illness, this includes anyone who has gotten sick, seriously sick from COVID. And previous suicide attempts is one of actually the most prominent predictors of someone committing suicide later on. Is that if they've ever attempted suicide before, they're more likely to commit suicide later on. Family history of suicide can also increase risk. Job or financial loss or loss of key relationships in your life are also important risk factors. And if someone has access to lethal means, either if they have a firearm like a gun or medications that could potentially be life-threatening, easy access to these lethal methods can also increase risk of suicide. And then also, we need to understand the warning signs, both in ourselves and also the people around us. Someone might not come out just saying that they're considering suicide, but they might talk about dying or wanting to harm themselves or not wanting to live anymore. Anyone who has expressed feelings of hopelessness or feeling trapped or feeling like a burden might actually be considering suicide without saying it. Any increase in substance use, either legal or illegal substances, could be an imminent warning sign. Changes in sleep is kind of one that you might not think of, but typically this actually will go along with severe mood swings and worsening mental health, is that people can have pretty big changes in their sleep patterns, either sleeping much more or much less. And sleep, especially sleep deprivation, can really impair brain functioning, and also increase risk of contemplating suicide. If you see anyone who is agitated, has a lot of impulsive behavior or rage, or if you yourself feel this way, these could be really important warning signs. And then going along with the risk of social isolation that we just talked about, if anyone is withdrawing significantly from people in their lives, not talking to friends, not responding to family members, that could also be another sign that someone is really suffering. And so if you see or if you experience yourself any of these warning signs, there's no need to wait. You need to seek help immediately. And this is not just for yourself, but if someone you care about is showing these warning signs, these are the following resources that you have at your fingertips. So there is a wonderful service called the Suicide Prevention Lifeline. It is 24/7 and confidential, and you can either call them at this number here. I actually advise you to actually record this in your contacts in your cell phone, so that you have easy access to it if you ever need it. Hopefully you never need it. But if it's if your contacts, then you can access it really easily. You can also go to their website, and they have an online chat feature if you're in crisis or if you know of someone in crisis. It's actually important here. I'm going to just pause and say that suicidal thoughts is actually a crisis situation in which if you can de-escalate something, if you can kind of get someone's mind off of their goal of harming themselves, you can actually save their life. So suicide is not something that's inevitable, and it's something where very quick interventions of just listening to someone or allowing them to talk about their feelings can actually really de-escalate the situation. So do not underestimate the power of just using these resources, either you yourself calling them or of a friend calling these resources and being guided on how to de-escalate the situation. In addition, there's a crisis text line. The number and website are available here on the slide. And that, if you feel that you are in imminent danger or someone you care about is going to imminently hurt themselves, you can always call 911. And it doesn't matter if you are not there personally, you can still call 911 and request a safety check to make sure that everyone is safe. Now, a safety plan is a tool that counselors will often go through with someone who has experienced suicidal thoughts in order to prevent suicide. This is not a replacement for those resources that I just talked about, but it's an adjunct tool that can be quite helpful. And I just want to kind of make you guys aware of this as a construct that can potentially prevent someone from committing suicide. And there are kind of stereotypical components of the safety plan. I'm just going to go over it quickly here. The first is writing down your personal warning signs. So everyone is different, but if you or someone you care about knows that there are certain things that trigger them to have suicidal thoughts, either images or situations or experiences that really kind of impact their self-esteem or make them feel very depressed, it's really important to recognize those and write them down to make sure that you can avoid them effectively. This could even include things like watching the news or social media. Those can certainly impact our mood, and it's important to be aware of those triggers. Second is to just lay out your own coping strategies. Now, it might seem kind of silly perhaps to write these down in advance, but in that crisis situation where someone is considering hurting themselves, that person does not have their normal, typical problem-solving capabilities. So it's very difficult to come up with these coping strategies on the fly when you're experiencing that level of emotional crisis. So having this all laid out ahead of time is really critical. So you don't have to figure it out then. You already have your plan laid out for you. So it's really important to have your own coping strategies listed out. That could be taking a walk, getting some fresh air, playing with your pet, or, it could be really anything that takes your mind off of the very negative emotions that you're experiencing at that time. A really important part of the safety plan is having the contacts of friends, family, and professionals that you can reach out to if you need help, or also agencies. And then lastly, it's important to make the environment as safe as possible. So if there are any lethal means in the household, like a gun or any medications or anything else that could potentially be life-threatening, that really needs to be removed from the environment if someone is at risk of having these thoughts of harming themselves. And then lastly, that's actually not on this screenshot of the safety plan template. It's actually just at the bottom, but I unfortunately got it caught off with the screenshot. But this is a really important question to ask yourself and have it written down on the safety plan. And it's actually an exercise that we can all do here. Even if your emotional health is 100%, I think it's really worthwhile taking a second to just think about what is the one thing that is most important to me and worth living for. And hopefully you'll never have to reference this, but if you're ever feeling so down that you're thinking about harming yourself, remembering your answer to this could be the difference between life and death. And so even if you're feeling 100%, I encourage you to think about what your answer is to this. You can even put it in the chat feature of this webinar if you would like. And I'll share mine with you. So the one thing that is most important to me and worth living for is really my family. They are very important to me. I know that, I can help them in ways that others can't necessarily, and that we're very close-knit, and we're there to support each other. So if any of us, harm themselves, it really impacts the whole nuclear family. So that's one example from my personal life. And I invite you all to, think through this answer for yourself, or even include it in the chat feature if you would like. If you want to see the full template of this safety plan, it is on the Suicide Prevention Lifeline website, and I have the link up here in case you need it. And then lastly, I just want to go over United Ag Resources. We are here to help you. As I mentioned earlier, mental health is something that's been really challenged over the last 1 to 2 years. And even if you're not feeling 100%, you need to start kind of seeking help to help build resilience so that you don't fall into worsening mental health that might trigger something like suicidal thoughts. And so we have Teladoc available to you. They don't just deal with physical illnesses, they also help with behavioral health. We have our website that you can access, and also you can actually call us directly too. If you're having trouble finding a provider, our member services can help direct you to the proper resources. And then I'm actually going to turn it over to Maribel quickly to talk about a new service that we have called My Strength.
Thank you, Rosemary. Indeed, starting October 1st, United Ag will be launching a new mental health benefit, My Strength Complete, a new benefit provided by our partners at Teladoc. I encourage all of you to attend the October 13th Ops Forum, as you'll find out more about My Strength Complete and how it's basically available to assist you with any of your needs regarding mental health or support. Let me see if I can share the link here so you can register if you haven't already. And once again, products or new benefits such as My Strength Complete are brought to our members because there's a need. We listen to our members, and so as you can see, any new product that is being launched by United Ag is for our members. So we encourage to get any feedback from you if there's any additional benefits that you would like to see. We're here to assist. Feel free to email membership@unitedag.org